Whittier Street Health Center has built a strong foundation within the Roxbury and surrounding communities, one rooted in healthcare equity and driven by the highest standards for providing quality care. With a service area that suffers from some of the highest rates of cardiovascular disease and diabetes, teenage pregnancy, and some of the highest crime rates within the Boston area, Whittier has responded with the ambition, the vision, and the expertise necessary to change the culture of healthcare in the community.
The vision of Whittier Street Health Center is to be the champion of equitable access to high-quality care for diverse populations. Using best practices and evidence-based guidelines, we're promoting a culture of health in our community through 6 strategies designed to address all of the different needs of our patients.
I became a patient at Whittier about 2 years ago, starting out in the OBGYN clinic, which is phenomenal.
These are all your little food containers?
My husband and I decided to start a family. And so then naturally, all of my prenatal care was taken care of at Whittier Street, and that rolled into pediatric care for my son as well. We participated in a program called Centering Parenting, which is one of the most unique healthcare experiences I've ever had. It is a support group. All new moms, no matter what walk of life you come from, need support. It also provides a place where we can see our pediatric care provider one-on-one, but in a group setting.
Our Boston Health Equity Plan is a strategic approach to eliminating racial and ethnic disparities that lead to poor health outcomes for entire families.
Through the Boston Health Equity Plan, Whittier is targeting the conditions most prevalent in the community while aiming to keep patients connected to individualized health services.
We also educate and empower our patients with chronic diseases to access, understand, and apply health information to the progress of their personal health goals.
I was coming out of a contentious divorce and I was extremely depressed and I didn't know anyone here. When I first went to Whittier, it was really actually more for physical medical checkup. The thing that really struck me was when they started asking about my mental and emotional health especially. I was in a very low state in my life that even the doctors, were able to recognize that right there and then. And so they made an appointment for me on the same day, and I went to see the doctor, and it was one of the best things that happened to me. They really took care of me from then on in all aspects of my health, whether it's emotional, mental, and especially physical.
Whittier continues to innovate and align new programming with the needs of the community, creating initiatives for the treatment of childhood trauma, prevention of youth violence, and the overall improvement of cardiovascular health within the community.
Through our innovative programs, we're working diligently to address wellness and prevention in our community, which we believe will contribute to the reduction in the high cost of health care.
I was diagnosed with breast cancer when I was 36. It was shocking for me because I was healthy. Breast cancer doesn't run in my family, so it took a while for me to really get over the fact that it was happening.
To be diagnosed was devastating for the family. Personally, for me, it was heartbreaking because there was little I could do, just be supportive and really lean on the care of the professionals, and we knew we were in really great hands, so that was certainly helpful.
With great health care, I was very lucky. I was diagnosed at the age of 36, and I'm now cancer-free 3 years. And the most important part of all this is that I was able to expand my family and have a baby boy.
I was living in New York, and I've been going to the hospitals a lot because I had a lot of problems with fibroids, and they found a mass in my kidney. And the doctor told me that he thinks it's cancer, but he says let it grow for a while. So he left it for 9 months. One day I was walking past Whittier Street, and I saw this beautiful building. And I said to myself, I'm going to join. I'm going to be a part of this health center. They didn't wait for anything to chance, to months for anything to grow or anything. That is the thing for me that was, wow, these people really care.
Being a patient-centered medical home means that Whittier provides preventive and holistic care using multidisciplinary teams of providers. All patients have a team of healthcare professionals who work with them to set health and wellness goals and to follow up with them in a way that is compassionate and engaging.
When I came here as a patient, I was thrown back by how nice and caring these people were here at Whittier Street. I said to myself that if they have an opportunity for me to work here, I would love to be able to work here. Here I am. I can walk, I can run, I can dance, I can do everything again like I had lost the ability to do about a year ago. These folks have been right by my side, and I've seen as a community that we work together. That's exactly what we do. We stick right by these clients' sides. I just had to be a part of it.
At Whittier, a dedicated team of caregivers strive to create a culture of health and wellness in our community. We do not wait for our patients to come to us. We understand the social and environmental determinants of health and are active in the community. We engage, empower, and educate our residents and patients through innovative community outreach and wellness education. We support them however we can to reach their personal goals for a healthy lifestyle. We take strategic and creative steps to promote health in our community.
Whittier Street Health Center. Comprehensive, compassionate, community.